Well, here at all of you, residents are exposed to almost anything that can walk through the door.
The thing that I think residents get the most out of their experience here is being the first to diagnose something.
There's just something unique and important about being the first person to evaluate this kid. Is they sick? Are they sick? Not sick? You know, what do I do? I think the attendings really trust our judgment a lot. So what you have to say really can dictate how we treat the kid and what we do with them.
All of you fits in quite well, I think, to our residency program in a number of different ways. The foremost probably being Gen Peds and a emergency room urgent care type of situation, which is a lot of what you do as a general pediatrician. Learning how to triage patients, get them through the urgent matters to the right specialist or to the right appropriate treatment.
So you get to really get a lot of one-on-one teaching in things like cardiology, nephrology, endocrinology, almost anything you can imagine. So that's something else that's really special about this site.
It's a great teaching environment. There's so much room to learn and have access to your attendings, and again, to sort of a patient population that really needs that type of service, that you learn so much when you're here.
The other thing I think is that this hospital, for the people who come here, is a community hospital. I know people have an image of a county hospital as a cold, impersonal place, but for the patients we have, they come here to get all of their care, their well child care, their parents come here to get care, and it feels like a home.
So I love being at the View. I think I really like it because it really gets this good outpatient clinic experience, and then we also do the ER, which I actually really love. You have a ton of autonomy, and really makes you feel like you know a lot about kids, because not everyone in the ER might know about kids, but you get to make a lot of decision making, you get to do procedures. It's really, really fun, and I love just the county patient population.
Absolutely, the residents, they love it here, and they really appreciate what we do for them. We appreciate what they do. Of course, this two-way street. And you know, when they leave here, they leave here as a friend.
So right now I'm at the NICU at Cedars, and one of the greatest things I like about being here is, you know, being able to do all these procedures, being hands-on with the patients. You just saw me doing intubation on a patient of mine that was having some respiratory distress.
Very skilled in blood draws and intubations. And also, you can see in the background, we actually have residents actually actively participating in an intubation right now.
The inpatient ward service is a tremendous mix of bread and butter and tertiary care peds, and it's a very, very rich experience. About half of our patients are bread and butter, and half are more tertiary and quaternary care in scope. Lots of complex congenital heart disease, liver failure, renal failure, metabolic genetics kinds of kids, and lots of rule-out sepsis, bronchiolitis, pneumonia, croup, asthma, all mixed together in one combined general pediatric service.
Santa Monica has actually a fairly different feel to Westwood. It does feel like a small community hospital. You'll get to know the nurses and staff fairly quickly. And we see lots of general pediatrics, basic cases, you know, the kids with asthma, kids with babies with fevers.
So I think the strengths of Santa Monica Hospital are you get a lot of general peds training. The attendings are all about teaching. We do teaching every day, morning report plus we get our own teaching, which we are part of doing, so we're responsible for that.
There's a lot of interesting cases as well that come through, and it contrasts really nicely with UCLA. I just finished a month on the wards at UCLA where I took care of sicker children for the most part. You know, for example, I was on the hematology oncology service, and then to come here and take care of kids that have medical issues, but they're less, you know, it's more in line with what I see myself doing in the future. So at the same time, I feel comfortable with sicker kids by working at UCLA, and now being at Santa Monica, I'm able to kind of focus in on patients that I may see more in the future.
Okay. I think one of the strengths of our program is the variety of clinics to provide continuity experiences for the residents. I'm a preceptor at PCC, the continuity clinic in Westwood, where a majority of our residents will spend 3 years, once a week, seeing their own patients. I think it's a fabulous experience, really an opportunity to form long-term bonds with the families that you care for, and really a good way to learn what general pediatrics is all about.
I have to say that visiting the new hospital, I was just really enthusiastic the moment I walked through the door, just because it communicates such a different message about who we are and what we're about, and I felt that a lot of the values of our healthcare are actually conveyed in the physical space of the building. You walk in and it feels like this really warm, welcoming type of environment where people were really going to personalize their care for you. And especially for the children's hospital, I really liked how the children's wall really kind of reflected our love and appreciation for children's healthcare and working with families. It's a really great blend of how medicine is both an art and a science, and the building embodies that.
So at Mattel Children's Hospital, we end up seeing the sickest of the sick kids, but we have a big team approach that takes care of the kids. Between the doctors, the nurses, child life, and all the other ancillary staff we have, everybody works together to take the best care of the kids we possibly can. And
it's very exciting, and as I mentioned, it's so unique. You know, we're one of the only centers that does the liver and small bowel transplants, so that's a very unique experience. And it is just really exciting to be involved with such advanced care.
I feel very fortunate to have found a program like the CHAT program. In fact, when I was researching residency programs, there aren't that many that afford you the opportunities to really focus on interest in community and public health during residency in pediatrics. Yet they're so important to the pediatric population and do require extra training. So I've had a wonderful time thus far. Feel like we really get to explore some issues in the community around Los Angeles and in the U.S. in general.
I think that there is a lot of guidance in the program. You always, right when you come in, you're assigned a mentor who meets with you several times a year, and you also have abundant opportunities to take on your own mentors as you decide throughout your residency what you think that you want to subspecialize in.
Yeah, I loved being a resident at UCLA. It was, to me, it was the perfect mix of just a lot of challenging patients, definitely a lot of learning, but I always just had a great time. I almost felt like my job was, it was fun.
And I remember opening my my acceptance letter and just being so thankful I cried. And my family was so happy for me. I was so very just excited to be able to have the chance to go to where I wanted to be and to be at a place that I thought I would really grow in. A place that I really would enjoy, not just learning to become a pediatrician and not just learning to be a doctor, but really learning to be a person and learning to be someone that was an active member in the community of Los Angeles.
What really hit it for me is in every rotation you have difficult not difficult patients, but poor outcomes or things that are hard. But for me with pediatrics, and I think most of us feel this way, you don't care how tired you are, you'll do anything for the kids. You don't care how difficult the parents are, you'll do anything for the family. You understand why they're upset. And even in times that are hard, I feel in pediatrics it's not just the patient, it's all about the family. So you really get to share the experience, good or bad, with the entire family. And I feel like that's a very important part for me, and it keeps me going when I'm like super exhausted and haven't gone to the bathroom and haven't eaten for a while. But so yeah, that's why. And it boils down to, who do I want to see every day? Kids. I want to see kids every day.
I can't emphasize enough how important it is to find a place where you feel happy and you feel like you can connect with some of your fellow residents. One of the other things that's good about this is it's a medium to large size program, and so our resident each class is actually very diverse. Everyone has a lot of different interests, but we can all get along really well, and we do work and play very well together.
There's times when you're going to be working really hard, but those are also the times that really are most rewarding. I don't think that most people can say about their jobs what we can say, that every day we really do make a difference, and we help a family, we help a child, whether it's giving good news or bad news. We are the ones that are really helping these families get through their experiences, and I think it's a really special place to be, and I think we should savor it.